The following dictation is going to be Lesson 12 of the StenEd Medical Q&A. It's going to be 160 words per minute for 5 minutes. Ready? Question. Doctor, in the course of your practice, did you have occasion to examine and treat Mr. Alderman? Answer, I did. I first saw him on January 27 at my office. Question, did you obtain a history from the patient? Answer, yes. I received a history from him that on the 20th of January at 9 p.m. while closing an elevator door which was not working properly, the release let loose and slammed on his left hand, cutting it. Question, what were your findings on examination? Answer, my finding on examination at that time was a deep laceration on the ulnar side of the left palm with massive infection surrounding edema and pain down the small or fifth finger. The entire palm was red. Question, in your opinion, doctor, were the findings that you made with reference to the left hand the result of the injury he described to you as having been sustained on January 20, 1989? Answer, yes, they were. Question, when did you see him next? Answer, well, I saw him every day for a week and then periodically up to March 10, 1989. Question, what type of treatments did you give him? Answer, well, the first treatment was debridement. That is cleansing out the wound and cutting away the dead tissue because the patient had been treating himself with antibiotic ointment and there was increasing infection. After that, there was treatment with betadine and we started on antibiotics. Betadine is a solution to heal wounds. Later, when the infection did not respond, we packed the depth of the cut and let it heal from the bottom up, using betadine again until the wound closed. Question, and was the patient disabled when you first saw him on January 27? Answer, yes. He was totally disabled until March 3 when he was able to go to work. Question, and was the disability the result of the injury he sustained on January 20, 1989? Answer, yes, it was. Question, how deep was the laceration, doctor? Answer, well, the laceration was deep enough to see the muscles in the small part of the palm in the hypothenoric eminence. It went down a ½ centimeter in the flesh. The laceration was about an inch long in a linear position horizontally across the palm about ½ centimeter deep, and the laceration depth was filled with what seemed to be the remnants of antibiotic ointment and pus. I did not know the extent of the laceration underneath there because there was no point in probing, just increasing the infection. Question, now, doctor, assuming the claimant's history of the accident to be true, and also assuming your past experience in such lacerations, what would you assume to have been the condition of the hand immediately following the accident? Answer, I should imagine that if he received his initial laceration, well, how deep it was at the time, again, would be a matter of doubt because the infection might have made it deeper subsequently, I should imagine, because there was a lot of destruction of the tissue because the injury was caused by something blunt. In other words, it had ripped the skin apart by force or pressure rather than a sharp instrument cutting it. I would say that he would have had a minimum amount of bleeding. How much, I wouldn't know. Question, well, let me ask this of you in a different way. I want you to assume that on January 20, 1989, that the claimant was employed by the 666 Main Street Realty Corporation as an elevator repairman, that approximately at 8:30 p.m. he was told to go to the 9th floor of 666 Main Street, that he went there, had some trouble with his elevator door, that finally one Frank Calder went up there to see what the trouble was and found Mr. Baldwin, a tenant, on that floor together with his wife and the claimant in the hall trying to open the elevator door, which was open about 5 or 6 inches. In other words, it was stuck and wouldn't open any further, and that the claimant was making no complaints whatsoever to anyone about hurting himself, that no one noticed any cuts or anything bleeding on his hands. I want you to assume further, doctor, that after this incident the claimant continued working for at least 2 hours without making complaints to anyone. I also want you to assume that the claimant says that after he pushed the elevator door back and that it stuck, he turned around to go back into the car and noticed that the door was closing. and that he reached out with his left hand to stop it, but couldn't, and he thereafter tried to pry open the door with some metallic object and got his hand stuck. That concludes 5 minutes at 160 words per minute.